Do you have someone with diabetes? Or do you know someone in your family with an outright diabetes? Are you diabetic? The answers to at least one of these questions would most likely be yes, because diabetic is quite prevalent in Africa. In Africa, diabetes is a leading cause of poor circulation, poor wound healing, stroke, heart diseases. In fact, diabetes is a leading cause of kidney failure in Africa. In Africa, more money and more revenue is being spent on diabetes than any other condition. Do you want to know how you had diabetes? Would you like to know? Well, in this video, I'm going to be giving 10 signs and symptoms of diabetes you should never ignore. Keep watching. Diabetes is a condition that alters the way our body uses sugar. Sugar is essential for our body to function properly and to produce energy. In order for sugar to get into our body cells, it needs an hormone called insulin. Insulin is like a key that unlocks the door of the body cells for sugar to get into the cells. If you do not have enough insulin, then you do not have the key to unlock the body cells for sugar to get into the cells. If you do have enough insulin and the body cells don't respond or react to this insulin, and still the critical sugar cannot get into the cell, then the sugar accumulates in the blood. This is what happens when you have diabetes. There is elevated blood sugar in the bloodstream, also known as hyperglycemia. The causes of diabetes are two major causes, which are genetic and environmental causes. The types of diabetes are two major types. We have the type 1 diabetes and the type 2 diabetes. Type 1 diabetes is as a result of the destruction of the cells in the pancreas called the islands of Langerhans, which produces insulin. These destructions of these cells are caused by what we know as also antibodies. These also antibodies are supposed to be fighting against bacteria, viruses, and other infections in our bodies, but turn around instead to start attacking our body's cells or our immunity. This is what we call autoantibody. They destroy the cell that produces insulin, leaving us without insulin. So when there is no insulin, then we have type 1 diabetes. In type 2 diabetes, insulin is available, but then our body cells do not react to this insulin. Sometimes type 2 diabetes may also lead to type 1 diabetes because the elevated blood sugar in the blood destroys the pancreatic cells that produces insulin, making the individual with type 2 diabetes have need for insulin. We also have gestational diabetes that occurs in pregnant women who are pregnant. In most cases, during pregnancy, the body's need increases for insulin. So, therefore, when the individual or the woman body is unable to produce adequate insulin, it then leads to what we call gestational diabetes. But prior to delivery, if the woman has never been diagnosed of diabetes, after delivery, the diabetes goes away. But for people that have already been previously diagnosed of diabetes, the woman may need to continue management of diabetes. We also have juvenile diabetes, which is also known as early onset diabetes, usually occurring in children and teenage. Now we move to the several 10 causes of diabetes you should not ignore. What are the signs and symptoms of diabetes? The signs and symptoms of diabetes, first is urinary frequency. Usually, for patients with diabetes, they have this increased sense to urinate because the body tries to eliminate the excess sugar by way of the individual urinating. So, as the individual tries to urinate the excess sugar, he passes out water as well. So, the individual tends to go out to urinate more often, more than the usual number of times a day. An individual usually urinates at least 6 to 7 times in a day. For situations where the individual begins to urinate more than 7, 8, 10 times in a day, and this alters the individual's normal daily activity, then there's cause for concern. He needs to visit the doctor or the hospital to be able to check, because this is a critical sign of diabetes. Then our number 2 signs is dehydration. Of course, as the individual is urinating, it tends to lose a lot of fluid and electrolyte, which in turn leads to dehydration. And in dehydration, the individual has skin changes, which leads us to our number 3 signs of diabetes. The skin changes, because there is dehydration that leads to skin changes. The skin begins to feel dry, itchy, and scaly. Our number 4 signs and symptoms is increased taste. Yes, the individual with diabetes tends to have a sense of increased taste. He wants to drink a lot more water often, because he's losing a lot of fluid already. The body tends to want to compensate for the loss of fluid by making the individual feel thirsty for more fluid. So the individual, as he drinks water, he loses water. He drinks water, he loses water. The cycle continues. And number 5 signs and symptoms is increased hunger. Yes, because of course, like we rightly said, body does not have reserved energy because of the inadequate utilization of sugar. It tends to make the individual get hungry easily. So as the individual is eating, is getting hungry. Is eating, is getting hungry because of the inadequate reserve of energy in our body. There are number 6 signs and symptoms is increased unexplained weight loss. Yes, because there is inadequate sugar reserve that brings about energy in the body. The patient tends to lose weight drastically, reaching about 10 to 20 kg even in a month. Of course, yes, there is a situation where you begin to lose weight unexplainably and drastically, then you should begin to quickly go to see the doctor, because this is also a cause for alarm, as it's most likely a sign of diabetes. And number 7 sign is increased recurrent urinary tract infection. Yes, of course, because our body's immune system is down, the individual has compromised immunity. There's increased urinary infection in our body. The individual begins to get infection, treats infection every now and then. There is also the risk of recurrent fungal infection, because fungal, of course, thrives where there's sugar. So individual with diabetes always have recurrent fungal infection. And number 8 symptom is tingling of the palms. Because there is damage to the peripheral nerve, the individual begins to have tingling of the palms of the hands. And number 10 signs and symptoms is blurry vision. An individual with blurry vision is most likely as a result of diabetes, because in diabetes there is damage to the retina of the eyes. This brings about temporary or permanent sight. If it's detected on time, it may revert back to normal, but if not detected on time, it may lead to permanent eye damage. We also have the poor wound healing because of loss of a nerve and poor circulation. The individual with diabetes have poor wound healing, inability for the wound to get healed on time. So when you begin to notice that you get injury and this injury does not go on time, then there's need for you to check and see the doctor, because it's most likely a sign of diabetes. So our last signs and symptom of diabetes would be fatigue. Yes, an individual that is diabetic usually have fatigue because, of course, like what rightly said, the sugar is not being well utilized in the body, so there's no sugar or energy reserve in the body. So the individual tends to get easily fatigued. It gets quickly tired and easily tired without doing much work. It gets tired easily. So that's one of the symptoms of diabetes. And apart from that, another reason why an individual with diabetes usually gets easily fatigued could be from the result of a frequent urination that he engages in. Going to urinate all the time at night, especially, this usually alters his sleep, and when he wakes up in the morning, he gets so tired that he would not be able to carry out any other activity. Apart from that, of course, like I've rightly said, sleeplessness causes fatigue, and also increased urination brings about dehydration. And when you are dehydrated, you also get weak on time and easily. So all these factors put together results in fatigue for the individual with diabetes. So if you know you are having fatigued, or you easily get tired after engaging in little chores or exercise, quickly visit your doctor, because this is a warning sign. It may be a warning sign of diabetes mellitus. In order to treat diabetes, there are major factors, that different ways in which you can treat diabetes. The non-medical modalities to treat diabetes is a change of lifestyle. For those that are overweight, you reduce your weight, and then those, if you're smoking or drinking, try to stop each of those. Stop smoking, stop drinking, then try to avoid your sedentary lifestyle, engage in exercise, active exercise. Those are modalities. Then eat rice. Avoid too much of sugary food in your diet, and refined sugar in your diet. These are non-medical modalities to actually manage or treat diabetes. We also have medical modalities, which is for the doctor to do. They carry out a lot of tests on you, like HbA1c, then do a random blood sugar test or a fasting blood sugar test, and other tests that needs to be carried out to be able to ascertain if you are diabetic or not. So guys, if you enjoyed this video and you think this video is very informative, do not hesitate to click on the like button, share this video, and leave a comment. And then if you have not subscribed, please do well to subscribe to this video. I'll see you guys in my next video. Thank you.